So let's start with fevers. People often ask, or parents often ask, how high is too high?
The vast majority of time, febrile seizures are self-limiting and they are pretty harmless. Okay, that's something we call a non-blanching rash. And those rashes are typically something that we need to get a closer look on.
It's 9 p.m. and my son has woken up and he is clearly sick and I don't know where to go. Do I call Health Direct first? How do I specifically get in touch with virtualKIDS from there? Hi, I'm Sophie Delezio, your host for Kids Health Explained. Today we're looking at a dilemma every parent or carer faces when their child is unwell. Where is the right place to go for help? Should you head to an emergency department, see your GP, or consider options like virtual care or an urgent care clinic? As a mum myself, I know how overwhelming it can feel to make that call in the moment, especially when you're stressed and worried about the health of your child. So today we're joined by Dr Jagdev Singh, medical lead of the virtualKIDS Health Service, to help us navigate the healthcare system and explain how virtual care options like Health Direct or virtualKIDS can take away the guesswork, especially after hours or for families in rural areas. Welcome. Thanks so much for coming on today. Really appreciate you being here. So before we dive in, can you tell us a little bit about yourself?
Growing up, I had a lot of dreams as any other as any other child. I think I at one point was obsessed in becoming a historian, and then another part I was obsessed in becoming a fashion designer. But I ended up doing medicine, and obviously I enjoyed it. I started working initially in Malaysia. And at that point, loved pediatrics and moved to Australia 15 years ago now, and continued working in pediatrics. And I trained in respiratory and sleep medicine. And in my career, I have two passions. The first is treating difficult to treat infections in the lungs using bacteriophage therapy, which was part of my PhD. And I often wear this pin around, which is a bacteriophage pin, proudly. In fact, I graduated this week from my PhD, so it was my ceremony on Wednesday.
That's so exciting.
A couple of months ago, I was awarded the Churchill Fellow for my work in bacteriophage therapy, which took me all over Europe to see what people were doing.
So I know a lot of parents would be confused about all the different services available and how they all fit in together. Can you describe each different services? I know people are probably familiar with the GP versus ED, but there are so many other services out there.
When we are dealing with a sick child, it can be a very confusing situation, and sometimes, you are deciding between, should I go to my GP, should I go to an urgent care center, should I go to an emergency department while managing a sick child. You're sleep deprived, you've got a crying sick child, and just having someone to help you make that decision is helpful.
So everyone's familiar with a GP and the emergency department, but there are actually two services in the middle that people can access. Can you describe them a bit for us, please?
These days, we've got things that are in between those two. When you've got conditions that might be in between, having to see a GP or presenting to an emergency department. So, like a mild sniffle or a mild injury, or simply if you're unsure about things, there is the virtual service, the health that's fronted by Health Direct, and there's also your urgent care center. So, for instance, if your child has fallen down and had a little bit of a graze in their knee that you wanted someone to check it out to make sure it doesn't get infected and so on and so forth, an urgent care center is a much better alternative compared to an emergency department.
And what are some other benefits to Health Direct and virtualKIDS?
So Health Direct is a national program. It's available 24/7. So it's available at the end of your phone. It's a hotline where you will speak to a trained nurse. By mentioning your child's symptoms or your own symptoms. So, it can be an adult, it can be a child. They can help determine what care you require. Behind Health Direct, there is a whole initiative by the Ministry of Health, by New South Wales Health, where there are services that support Health Direct to help make even better decision, higher level decisions. So for example, this is where virtualKIDS, we sit behind the Health Direct platform where we provide that additional support to their clinicians. There's a similar service for adults as well called Virtual Adults, and these are statewide services. Then there are linkages to other health services such as Breastfeeding Australia, New South Wales Poison Hotline, mental health helplines, and so on and so forth. You are interacting with a lot of different services that you can be referred to behind that Health Direct or single front door.
Okay, so it's 9 p.m. and my son has woken up and he is clearly sick and I don't know where to go.
So first things first, when you have that question, you pick up the phone, you call the Health Direct line. A nurse on the other end of the line will take those details, will try to understand the situation and refer your child on depending on their needs. So a child might need an emergency department visit, or a child might need to speak to a virtual GP, or they're not that unwell that they might be able to go to your regular GP the next morning. So the nurse at Health Direct will help you decide where the next step of care should go to. And that's where virtualKIDS may get a referral. If the child is eligible, there is a requirement, and the child will benefit from our service. So obviously there are criteria. The nurse will, what we call, refer your child onto the virtualKIDS service. And then from there, they'll be picked up by one of our highly trained nurses who will then perform an audiovisual assessment on your child, because what is more important is in pediatrics, being able to see the child will give us a lot more information than just talking on the phone. And all of our consults that we do are based on audiovisual reviews as well. Now, the other thing is if a family does not speak the language, does not speak English, you can get interpreters as well to be able to help interpret the symptoms, and so you get on to virtualKIDS with an interpreter as well. Amazing. So the equity of care is there, and everyone should benefit from such a service.
So let's start with fevers. People often ask, or parents often ask, how high is too high, especially when it comes to a baby, specifically under 3 months. What temperature is the point where they should go to emergency versus just a regular GP, or even stay at home?
Yeah. So fever is one of the most common signs of illnesses in children. And, we know that children, they tend to pick up all sorts of infections from daycare, from the park and things like that anyway. So it's common. Okay? And a lot of times parents get worried about the height of the temperature, how high the temperature is. But that necessarily does not mean that it's a worse infection. The height is not exactly something that is in itself dangerous. And in most cases, fever, they can be managed safely at home, right? But there are, of course, red flags. For instance, like if an infant has a fever and they are less than 3 months of age, that needs medical attention. They should be assessed. Or if there is a rash that when the parent presses on it and it doesn't disappear, that needs medical attention. If there's difficulty in breathing or a change in the behavior of the child or their demeanor, that needs a little bit of a closer look. And ultimately, if there is any concern about fevers, it's always good to get early advice. But that doesn't mean needing to go to an emergency department to get an advice. You can actually get your advice from what I mentioned earlier, Health Direct or Urgent Care Center or your local doctor as well.
Absolutely. So fevers shouldn't be the first point at which we panic. There's a lot more we can do behind the scenes. And what's your recommendation when it comes to paracetamol and ibuprofen?
Parents can give over-the-counter medication such as paracetamol or Nurofen, but it's important to follow the instruction on the label. make sure that the doses are correct. And of course, if it's persistent or if it's getting worse or things are not improving, then medical advice is definitely recommended.
Breathing issues are scary for any parent. What are the signs that a child might need to go to the emergency department or when things get a bit more serious?
And breathing issues or breathing difficulties, when you see your child you're struggling to breathe, it is obviously really frightening. And a lot of times parents make decision to either, go to an emergency department, some call an ambulance, some call Health Direct, but a lot of that depends on what's happening in that moment, right? There's no necessarily right or wrong. Trust your instincts. Certain red flags that we need to look out for. For example, if the child is struggling to breathe and it's interfering with their ability to speak or feed, or they've got blue lips, or if they're complaining about, you can see that their every breath that they're taking is not only fast, but the muscles around their neck or between their ribs are being pulled in. Those are usually the signs that you need to present to an emergency department. But not all breathing difficulty necessarily you need to immediately go to an emergency department. Sometimes a mild wheeze or a barking cough or a little bit of a tug between the ribs, that can be managed quite safely by your local doctor or the urgent care center or even a phone call to Health Direct. And oftentimes they are there to help you navigate those decisions. Should I go to an emergency department or not? But ultimately, looking at your child, your instincts also is quite important.
When it comes to vomiting or diarrhea, when can you manage it at home versus when is it time to see a doctor?
So vomiting and diarrhea is another one of the more common illnesses in children. Vomiting and diarrhea, vomiting with diarrhea particularly, quite common. Usually it occurs during springtime, and it can hit the entire, school or classroom as well, and it spreads quite quickly. Now, the most important thing about when a child is having diarrhea and vomiting is maintaining hydration. And if your child is able to keep up with their hydration, small amount of fluids regularly, they don't have dry lips or dry tongue, they're producing good amount of wet nappies or urine, good volume, good color, and are not, getting more and more lethargic. Usually with some oral rehydration fluid or with regular fluids, nourishing fluids, that usually can help keep the hydration intact. For us clinicians also, maintaining hydration is the primary. And what we like to do is maintain hydration orally. But sometimes, despite of our best effort, oral hydration does not work. The child is unable to tolerate it and is getting more and more tired, lesser nappies. They are getting, their lips and eyes, their lips and tongue is getting dry, or their eyes is getting sunken. That's usually signs of worsening dehydration. And sometimes they need a little bit more support. And that could be in the form of either intravenous fluid or fluid through the nasogastric tube, through your mouth or their nose. Now, and that can happen. Doesn't happen often. And usually we can manage a lot of rehydration orally because we prefer that in a natural way, because it's natural, right? And just like what I mentioned with breathing difficulties, it doesn't mean that if a child is vomiting or having diarrhea, they need to go to an emergency department. A lot of times this can be managed very safely by your GP or an urgent care center, or even an advice through Health Direct.
I know when my son has gone to the ER before when he was quite unwell, they would give him fluids through a syringe, a little Panadol Nurofen syringe, and just 5 mils every 5 minutes, I think it was.
Yeah.
Just that little bit. You often think about them needing to scull a whole bottle in one go.
Yeah.
Sometimes it's just that little amount to keep them going. Absolutely. Really makes a difference.
It's that small frequent amount so that they can digest it better. And somehow, after a while, it might seem onerous when we're doing it, and it might be difficult sometimes to do it over an hour, every 5 minutes, over an hour or 2 hours. But then suddenly the parents will notice that the energy levels are increasing, and then the child wants to eat more. They might ask you for Macca's as well.
I think it was a 4 a.m. trip to Macca's after that for mainly my husband and I. It's something that I never really thought about before then. And so what are the warning signs of dehydration that a child might need, more IV fluids or regular fluids?
So signs of worsening dehydration, obviously, usually we say that, if they are drinking less than 50% of what they're usually drinking, and despite your best effort, you can't actually improve that, reduction in their urine output, that again, it's less than half that what they would normally have in terms of volume, darkening of the color of their urine, and also how the child looks. They start looking more dry, more tired. They want to sleep more. That's usually something that we need to look into.
And when it comes to giving fluids, should we focus on water? Or I know sometimes medical professionals recommend apple juice. Is there sometimes milk if a child really enjoys milk? Is it kind of at that point just any hydration is good hydration?
As much as possible, the usual, to maintain hydration is the usual fluid that your child takes. For instance, if it's a breastfeeding child, it's regular small amount of breast milk. That's best, obviously. Sometimes, or milk, as you mentioned, but sometimes they can't keep that down. So that's when we start thinking about alternative fluids. Like we usually mention clear fluid, particularly oral rehydration salts. Especially in children over 6 months of age. Usually we do advise trying to improve their hydration with oral rehydration salts because they contain glucose in there, they contain important salts so that they remain energized and we can maintain their hydration.
Absolutely. So there's a bit more there than just plain water. That makes a lot of sense. I guess the other thing that often you hear about is rashes. It can be all over their body or just in one place, and it can give parents so much anxiety. How do you tell the difference between a harmless rash and one that needs urgent care?
Another really good question, Sophie. So rashes are very common in children. Thankfully, most rashes are benign. When I say benign, means they're harmless, okay? So a heat rash or an mild eczema rash, or sometimes viral infections can lead to a rash as well. And generally, they are what we call self-limiting. They improve over time and they don't cause as much issues. There are certain rashes that we need to be a little bit more worried about. For example, if your child has a rash, and if you press on it or you press a clear glass on it and that rash doesn't disappear, that's something we call a non-blanching rash. And those rashes are typically something that we need to get a closer look on, because sometimes that can mean a condition called meningococcal infection, which could be dangerous. Now, doesn't mean that all non-blanching rash is meningococcal. Context is important.
Yes.
So obviously, but the first thing that we need to do if you notice such a rash, we need to get that assessed, whether or not this is something more sinister or something we don't need to worry about. But again, rashes can be quite tricky, and it's always worth getting in touch with your local doctor or getting advice from Health Direct, or even presenting to an urgent care center if you feel that your child is looking unwell. I think that's quite important. And the reassurance that we get to say that this is a benign rash, I think that's really valuable.
Absolutely. Any type of seizures is always going to be terrifying for a parent. What should they do in that moment that your child is having a seizure, and when do you call an ambulance?
Yeah, I agree. Febrile seizure or seeing a child seizing can be very frightening. Even for seasoned medical people, it can be something quite distressing as well, let alone for a parent, especially if you're alone at home. The vast majority of time, febrile seizures are self-limiting and they are pretty harmless, okay? And the part about being a parent being helpless, technically you're not helpless. There are things that you can do to help your child. First things first is, if you see your child is seizing, you need to put them in a position that they are safe. So you need to make sure that they don't have anything that will potentially injure them while they're having the seizure. What we call a position, where we call recovery position, where you put them on their left side or on a flat surface. That's important. Never ever put anything in their mouth because you can end up injuring them. I know people usually say you need to stop them from biting their tongue and things like that, but we don't do that. We don't recommend. We just need to make sure that they're safe. Time is also important. Most febrile seizures will resolve after a couple of seconds to minutes. But if the seizure is prolonged, it's going beyond 5 minutes, that's when usually you call an ambulance. And that's quite important. Okay. The vast majority of time, if the seizure stops after a couple of seconds and under 5 minutes, and the child recovers and gets back to their usual self, there's no change in behavior, they don't look very lethargic or drowsy, then of course getting medical advice with your GP, urgent care centers, or even calling health direct can be quite helpful because we don't want to miss anything sinister. So it's a good place to start, and it's important to check in because, as I mentioned, most febrile seizures are quite self-limiting and quite harmless, but checking in is quite important.
And if it goes longer than 5 minutes, is that when you recommend calling an ambulance?
Yes. So if it goes beyond, that's something that needs to be assessed and assessed quite quickly as well. We don't want a child to continue to have seizures for 20 minutes, an hour and things like that. And it's quite hard to predict at that moment. So 5 minutes is usually a good time if it's continuing to call the ambulance. Or if you start seeing like the child is having breathing difficulties or change in color, of their face is becoming more dusky or blue, that's usually when we should consider 000.
If a child is in a lot of pain that doesn't seem to ease with regular ibuprofen or paracetamol, should parents head to the ER or wait until they see their GP?
So Panadol and Nurofen is an obvious choice when our child is in pain, and it's a good place to start. And a lot of times the pain can resolve after 1 or 2 doses of Panadol and Nurofen. But we should start looking deeper if the pain is not resolving, it's getting worse, or if there are other symptoms. For example, you are noticing that your child is not moving a particular limb properly, or is walking with a strange gait, or is now developing a rash that you're not sure about, fever, or there's a significant change in terms of their behavior, they're looking more lethargic. That's something that we need to look a little bit deeper into. The duration of pain as well, if it's prolonged, more than 48 hours, why is that happening? That needs to be checked. Doesn't necessarily mean you need to present to an emergency department, but it needs to be seen by a doctor, by a health professional. That can be done again in an urgent care center or by your local doctor. But if you are seeing unusual signs like they're unusually sleepy or irritable, or if their gait has changed, or if they are now developing a rash, or simply if the pain is getting worse over time, an emergency department visit might be helpful.
I know I experience this with my son a lot, but kids bump their heads quite a bit. How do parents know when it's serious enough to go to the ED?
Yeah, you're right. Kids bump their head all the time. It's so common, and fortunately, they are usually minor. But there are some warning signs that we need to know about so that we know when to act. And the big red flags are if after a head bump, they've got repeated vomiting, not one, but multiple vomiting. They've changed in their behavior, or they've lost consciousness, they're becoming more and more drowsy or confused or just not acting like themselves, that's usually when we should get it checked or present to either an urgent care center or an emergency department.
What if they just vomit once and just seem a bit off? Is it still something we should get checked out?
So yes, of course, after head bum and vomiting, they should be checked out, but that doesn't necessarily mean that they need to run to the emergency department.
That makes a lot of sense. For injuries like possible fractures or cuts, when is the emergency department necessary, and when can a GP or urgent care clinic help?
So most minor injuries like cuts, grazes, bumps can be managed quite safely in a GP center or even in an urgent care center, and most are equipped to manage simple injuries. Now, a good rule of thumb for us to know about is if a child can still walk, move a limb, and the pain settles with simple medication, it is reasonable to start with a GP. And if they can't walk, won't use the limb, or if the pain is worsening despite medication like Panadol and Nurofen, then ED might be a good option. And again, if something doesn't feel right, it's always to err on the side of caution.
Yeah, absolutely. I love clear and simple. It's a really good way to measure it. So when your child falls and there's inevitably cut and blood, or it could be any reason, but there's blood, and it often seems a lot more dramatic than what it is, especially when you try and wipe it away and you got a wet cloth. The water just creates more what looks like blood, but it's just spreading it everywhere. First point of call, you suggest Health Direct or your GP. What do you recommend?
So when you see your child bleeding and they continue to bleed, and I think the key word here is continual bleeding. So, if they've got a cut and a graze, first things first is first aid. Clean the area, try to stop the bleeding, some compression. And usually if the bleeding stops with once you provide compression, that doesn't necessarily mean that you need to run to an emergency department. A GP can check that out. But obviously, if the bleeding doesn't stop and it's ongoing and it's just still pouring despite of what you've done, then probably ED is a better port of call, because it might indicate something more sinister. But again, at the end of the day, it is also about your instinct as well, on what seems to be appropriate at that time.
So let's finish with some quick takeaways for parents and carers.
First thing is trust your gut instinct. If you feel something is wrong, check it out. Okay. Second thing is a lot of mild to moderate illnesses that occur in children, you've got options. Health Direct or urgent care centers or your local GP. Emergency department is there. It's open 24 hours a day, 7 days a week, 365. Yes, it's there. But there are other options that can help as well.
Thank you so much for coming in today, and thank you so much for the work you're doing. We are so appreciative of your time and knowledge.
No, thank you for your time, for listening me talk.
Thanks for listening to Kids Health Explained, a podcast brought to you by the Sydney Children's Hospitals Network. If you found this episode helpful, please like and subscribe and share it on to any other people you might think could use this sort of information. For trusted health advice, please head to the Kids Health Hub on the Sydney Children's Hospitals Network website. Take care, and we'll see you next time.